Hey everyone, welcome to Political Radar Echo, 30 minutes of political talk about current topics with panelists from a variety of viewpoints. I'm your host, Cassandra Hautala, and this is episode number 3.
This is Political Radar Echo with Cassandra Hautala, where we cover many political issues affecting our country with a panel of guests from many viewpoints.
Our panelists today are Jenn Schiavo and Jeremy Hautala. So, I'm going to start with Jenn. Could you give us a brief introduction?
How brief? No. I am Jenn Schiavo, and I am a disabled veteran located in Green Bay with a wife and 2 kids. I mean, is that good enough?
Yeah, that's great. Jeremy.
I am Jeremy Hautala, and if the name kind of sounds familiar to the host, yes, I am Cassandra's spouse. I do have a pre-existing condition. I am an insulin-dependent diabetic, so it's very important that the pre-existing condition clause stays into effect for myself and my family.
So they've kind of introduced what we're going to talk about today. Obviously, we're going to talk about healthcare. It's kind of been on everyone's mind the past week, and those words, pre-existing condition, have really been the buzzwords of the week. So I think we're going to start with that, and then we are going to move into some of the VA stuff. Jenn has shared with me interesting information that I had never known before. But let's start with what happened last week. The House of Representatives passed their version of repeal and replace the ACA with their own bill. They're calling it the American Health Care Act of 2017, passed by a vote of 217 to 213. So definitely a close vote there. From what I read, all of the Democrats voted against it, and 20 Republicans actually voted against it as well. They thought it rolled back too many of the benefits. So Jeremy has done a lot of research on this. Could you give us a little background? I think it's really interesting that you're here to talk about this because I remember, during Obama's first term, we talked a lot about Obamacare and the ACA. How did you feel about that back then?
I strongly opposed it. I had my own reasons, but I wasn't in tune with reading all about it, honestly, and becoming more informed about it. But over the years, obviously with having a pre-existing condition and just reading more about it, my support went towards affordable health care. And that's why I strongly support it now.
But is it truly?
Jen, do you want to move?
For everyone.
You want to move closer?
I'm sorry.
That's
is
okay.
It truly, affordable for everyone?
It's truly not affordable, but it depends on in what context. Right now, nowadays, it's all about income. So that plays a huge role into it. Also, the pre-existing conditions play a huge role into it. Myself, I was diagnosed with type 1 diabetes when I was 22, 23 years old. So I've been living with this for, going on 17 years now. And for diabetics, it's really normal to be diagnosed usually before the age of 6 years old. So I had nothing that struck, that would state I should get this condition. I did not have a family history. I did not have any symptoms besides the ones I was starting to get when I developed my sickness towards it. But I want to clarify, too, the pre-existing condition and what that actually means, because I think there's some, for lack of a better word, there's some confusion there. A pre-existing condition is something that it's a health condition that exists and is diagnosed and treated previous to you enrolling into a new healthcare program.
Right. So a lot of stuff that I've seen, the Republicans have said this really won't affect you if you have employee-sponsored healthcare or if you are on Medicaid, which is something we'll bring up a little bit later, or if you're in the VA, things like that. They're saying that it won't affect you. What do you think? Do you think it could trickle down to us, those of us who have employee-sponsored?
Yes, including myself. I do have employer-sponsored health care. It will trickle down to me eventually. There's a lot of small print that's not being put out there for the common knowledge for everybody to kind of understand about it. The protection, number one, that affordable health care gave was that it would not deny anybody insurance. It would not put any annual or lifetime caps on the coverage that you would get. Those are huge because, especially for me being diabetic, I can't predict how much my health care is going to cost. I can't predict if I'm going to have to go into the emergency room for something related to my condition. So those limits really play a huge role into being able to care for myself.
Right. So another thing that, what they're saying is that they're not going to do away with covering pre-existing conditions, but states can seek a waiver saying that they don't have to cover it, and then they could create this high-risk pool. And they could seek a waiver to do away with 10 of the what are called the essential health benefits that the ACA has covered. One of them that has come up has been outpatient, which is important to you. Another one, mental health, came up. Mental health would be one of the things that are not covered. Now, why I bring this up is because, Jen, this could tie right into you with the VA. A lot of veterans who get mental health care through employee-sponsored health care or other ways, like Medicaid, could be possibly kicked off of this. Then that goes into you, and they are forced into the VA system.
Which can't even support, the amount of veterans that we have right now at the time. So
Okay.
if I think what they were saying is it could affect, 7 or 8 million veterans that are not enrolled currently,
Right.
or there's 8 or 9 million of them, somewhere between 7 and 9 million. And if that affects them, then they will have no other choice but to fall back on the VA.
Right.
And of course, you have that right if you're sick,
Right.
I mean, that's what we signed up for. But the
Right.
thing is that they're not staffed.
Right.
VA is just not, it's not capable of that load right now.
Right. So that mental health piece of it could affect a lot of people, including veterans,
Very
even
scary.
they're saying that this doesn't affect people with the VA. An interesting point that we should bring up is that a lot of the states have said they wouldn't do this, but we are here in Wisconsin, and we have Governor Walker. He was the only one who said he would potentially seek out this waiver. So,
Do we not have term limits?
term limits. That's another show, Jen. That's
Oh,
another
sorry.
show.
Okay, however that needs to be discussed.
Yes, I do think we should talk
Sorry.
about term limits. But yeah, so he would be interested. He has said that in Wisconsin, we already had a really good, according to him, we had a good high risk pool that covered people before, and he would like to go back to that. Now, Jeremy, do you remember when we were without insurance and we tried to get into that high risk pool? That was the only way that we as a family could have gotten insurance.
I purposely threw that memory out of my brain.
Right.
Because it was a very
80,000?
contentious period. It was a very, I was paying for my insulin with credit cards, and insulin is thousands of dollars per month.
Right.
So that's why I threw it out of my brain, because it was a really bad experience. It was a traumatic experience, just trying to make ends meet for our family, make sure that we had a roof over our head, food on the table.
Right.
It was a rough period in our life.
So if we were to go back to this where states can seek the waiver, they can not cover these essential health benefits, the pre-existing conditions, we're back to a high-risk pool. Now, the new health care bill says what was the amount for it? Does anyone remember what the amount was for the high-risk pool? Like $8 billion that they would offer money for this high-risk pool. Now, if memory serves me correct, I believe it was like a 6-month waiting period to even get into that high-risk pool back when we were looking for insurance at that time. So it should be interesting to see if that happens and what effect this has on people
I mean, they go into debt, obviously.
Obviously, that's one of them. But number two, I mean, it depends on what employer you go through. Usually they have like a 30, 60, or 90-day waiting period before you can be enrolled on their health insurance plan. I know previous to the Affordable Health Care Act, it took me, I think the employer that I was with was 60 days. But I could not get coverage until it was like the 6th or 7th month, just because of the fact that it had to go through the pre-existing clause and go through all the hoops just to be accepted. And that's the beautiful thing about what we have currently is you're protected from that. If you have a pre-existing condition, you are protected from that. And that is a huge benefit to you and a huge benefit to me, as well as just making sure that I can be taking care of myself with no annual limits.
If you hadn't have had a credit card and good credit, which a lot of people don't have, you wouldn't have had your insulin. So that senator or guy that came on today and said nobody died from lack of health care was really just wrong.
That's the thing that the Republicans are doing right now is they're just killing themselves with what they're saying to the media. I mean, that statement right there.
To make something clear, in past years, how have you voted?
I have always voted Republican.
Okay, thank you.
And I'll be, full disclosure, I have voted Republican all the way up to this past election. Supported them through and through. But the current administration made me I had a change of way, So, yeah.
I've never
Thank you for bringing that
voted
up, honey.
I always vote on the issues, never a straight ticket.
Right.
So
I could say the same, but it always tends to lean one way. So.
I know, right? Well, the way we feel about things.
Right.
Of course, I just can't imagine having to pay $5,000 to $10,000 a month for my medication, which I've never had to do. I've never had to do that. So
in this country, there, and I can't remember the exact figure, but it's between 20 and 30 million people that have diabetes in this country.
Yeah.
So I think 60% of that are insulin dependent, or is 40%.
So is it really the insurance that we need to be fixing, or is it the lobbyists, in Washington allowing hospitals to charge this and, pharmaceutical companies to make these drugs for 10 cents and sell them for thousands of dollars on the market?
Right, that's a whole other issue.
And a doctor that my daughter saw for less than 10 minutes, he was in there, orthopedic surgeon, won't say any names, but we got the bill, and for less than 10 minutes, our bill for him was $578.
Right.
What?
Right. So, right. Obviously, we have some inflated costs there. So,
but my ex-husband, he keeps the kids on his insurance because I don't. As a vet, you don't get that. Here's one thing most people don't know: if you're a disabled veteran, you have to be 100% permanent and total to get any coverage for your family. So, if you're less than 100%. Not going to get it. And then if you're 100%, as I am, but I'm not permanent total, then you don't get coverage for your kids. So I do have to touch on this stuff with, bills that come in. And my ex-husband, he does what he does with his insurance, and he has a $10,000 deductible, and then of course I have to help him meet that.
Right.
So it's
and under one of the 10 essential health benefits that states could waive, one of them is pediatric. So that goes after our kids.
Should we talk about the 10 essential benefits or should I at least mention the 10 essential benefits?
Sure, go ahead. Mention the ones.
Ambulance emergency care, hospitalization, pregnancy and maternity, newborn care, mental health, which is a huge epidemic these days, prescription drugs, rehab for injuries and disabilities, lab services related to any care that you have, preventative care, and like you said, pediatric care.
that's basically everything.
Good chunk of it.
Right. Birth control, and I saw also on there breastfeeding support as well. So those are all things that a state could choose to waive. So far, only Governor Walker has stated that he would be interested in that waiver. He did backpedal a little bit, but
I'm not going through with it right away.
Right. I mean, kind of political suicide in my opinion.
Well, and
but
also too, I do want to. I mean, because statistics really kind of like they invigorate me. But 129 million Americans suffer from some sort of pre-existing condition.
Oh, I'm full of them.
Right. I had read 27% of adults under the age of 65 suffer from some sort of pre-existing condition. So that's a lot of people that this affects. And we've mostly talked about you with the diabetes. We'll get into Jenn's a little bit more, but I mean, what about women having children? And
They say that's a
right.
pre-existing condition. I mean,
Right.
that's what I saw today.
Maternity is a
And how
pre-existing
can having a
condition.
baby be a pre-existing condition.
And you know, the funny thing I read too is back in the day before affordable health care, there were 8 states that recognized sexual assault as a pre-existing condition, as well as many insurers classified rape as a pre-existing condition. So just to throw that out there for you too.
Well, and see, now this goes into the Senate, and the Senate has put together their committee
Die.
to they've put together their committee, and so we've said that a lot of this has to deal with women. 13 men on their committee.
That's all men.
Yeah,
All old, stuffy white men. I'm sorry.
Thank you, Jenn. So one of the other things that has come up is that this would also be a decrease in federal Medicaid funding, the bill that is going through the House, or went through the House, sorry. It would be a decrease of $880 billion over the course of 10 years. The Health and Human Services Secretary claims it's not going back on Trump's promise to cut Medicaid. It's just that it's not a cut, it's just restructuring.
Oh, so limiting enrollees in 2020 is not cutting back at all?
It's not cutting back.
Oh, okay.
It's creating a condition in which it's no longer necessary to spend that money.
So the way I see that restructuring is, and how it will affect veterans from my point of view, is they'll be like, oh, well, you have the option of the VA, so you don't need us.
Right.
Which a lot of veterans, and it really, like I said earlier, it depends on the region, I think, the kind of care you get. They are afraid of their VA, and they have every right to be. I mean, they misdiagnose things. I'm not saying here in Wisconsin I have an excellent, Green Bay has been very good to me, but a lot of them are very afraid, and then they depend on that. If they're also, SSDI, and they get the Medicare or the Medicaid, I'm not sure which one it is, they depend on that so they can go to the civilian side before we were given choice.
Right.
And so they're going to take that away from them, and now they're not only afraid, but now they have to go, but they're going to call and they're like, sorry, we can't see you until, 7 months from now, or.
Right. Yeah. I mean, from what I'm seeing, this would really put a strain on the VA system. I read that the Medicaid expansion that happened under the ACA actually really helped reduce the number of veterans without health insurance. People who didn't want to take the VA benefits couldn't take the VA benefits.
Oh, there is a lot of those. I mean, not everybody that is a veteran qualifies for the VA, and it's not like you just, you've been healthy, you've been out for 5 years. Say you've been out for 5 years, you had an honorable discharge, and suddenly you're sick and you're in between jobs, and you're like, oh man, I'm just going to go to the VA. You really can't do that.
Okay, so explain the process a little bit.
You have to apply.
Okay.
For VA health care. And of course, sometimes that comes with you're going to file a claim to see if you can get, if you're sick, if you have service connection and stuff like that, or you got sick while you're in the military, and now it's flaring up, which they're more and more having, veterans that are getting out now, having them do those claims as soon as they get out. So even if you're in what I did, it took me 10 years, but I've been service connected at 0% with several things that are now horrible and out of control, and so you need those down the road. But when you join, not everybody, it's not you're a disabled veteran or you're not. You are, but you can be anywhere from 0% to 100%.
Okay.
And that depends on, and depending on that, depends on what priority group you are in for healthcare. There's 8 priority groups. And I'm number 1, which is 100% disabled veteran, service connected. That's first group, but there's 7 other priority groups. And they fall in line, who gets service first, who gets the first surgery, who gets, the best, not the best care. Well, depends, but that's how it works. And these are veterans that are waiting, years for a decision on their disability claim and stuff like that. And it's just, I mean, they have no income, they have no health care, these are people, that not everybody went and fought in the war, but everybody supported it, and they, they can't do anything. They can't take care of their families. And, with the hiring freeze, they dropped Taylor, my oldest daughter, they dropped her as a dependent almost a year ago. And all that is them just adding her back as a dependent, which is quite a big chunk of money for us.
Okay.
And they dropped it a year ago, and it's taken them, they still haven't added her back. So you can imagine something that small has taken almost a year. Can you imagine these people with multiple disabilities trying to get health care?
Right.
And you just can't. It's
Yeah.
hard.
So the reduction in Medicaid, you think would really have an effect on you and your care?
I don't know about me personally,
Okay.
but I think the system as a whole, and I think it will trickle down. Yeah, I think it's already difficult.
Yep.
I mean, I don't understand the ins and outs of any civilian health care, really. But I went straight, 19, I joined, by 25, I was sick. And so I went from my parents to DOD to VA, and that's all I've ever had. So I don't know how it works. And it gets really confusing because Jamie would be like, you need to pay for this. And I'd be like, but they just went to the doctor. Isn't it covered? It's not like that, It's,
Okay. You brought up the choice program briefly.
Yes, which is excellent. But we did have something in place before choice came in. But I think the problem was it wasn't accessible for, veterans that are, say, only 30% service connected or 50%.
Okay.
And it was called fee basis non-VA care. And I did hear that they're saying that Trump did extend the choice contract with who were using
Yep.
HealthNet for our region is HealthNet till the end of the year. And honestly, we do their. That sounds horrible. Here it goes, honey. We do their jobs for them. I've got to call them, nonstop about, you got to. I've already have, or they'll call me and be like, well, I've been at the same doctor for 3 years, and I have to have a renewal every year. And they're like, would you like us to make you a new appointment with a new doctor? No. Can't you just read the file?
Right.
Just to prove it.
Right.
But it's very difficult. And a lot of places here, my providers are getting paid, but a lot of them are not getting paid. And these hospitals won't hold on to bills. They're supposed to, but I think they're supposed to. My credit was run too, because they don't pay on time.
Yep.
I mean, it can take them a full year to pay, and Bellin and Aurora and place, they'll just send the bill and they'll send you the collections, and we have no way of paying that.
Right. So in that way, it kind of puts you in the same system as us, where we get a bill, maybe insurance doesn't pay it, we don't realize it, and all of a sudden we're getting collections letters. So the VA choice kind of puts you in that.
Yeah, and then
That
you're on the phone,
situation.
nonstop. Like, you need to pay this. It was approved.
Okay.
It's a mess.
And that was set to expire in August, but
Yes.
it is.
It's extended, from what I've heard, it's extended till the end of the year.
Okay.
And I would like to say that the Green Bay VA is excellent facility. They have great providers, great pharmacy staff. I mean, their staff is excellent. They've taken really good care of me.
Mm-hmm.
It's not the local people that we have a problem with. It's the bureaucracy, the upper levels,
Right. And you mentioned too the hiring freeze that happened, I think, just a few days after Trump took
the
office.
federal
And I thought
hiring
he
freeze.
lifted that, but
No,
no, he hasn't. Okay.
not official.
So any doctors that were set to come in, let's use Green Bay as an example, they have been short-staffed. There, say at that time period, if there were any doctors set to come in but they weren't in yet, that was terminated. And I already said they're understaffed.
And you mentioned to me how many patients were on a caseload for a doctor?
For a doctor, this last summer, not even almost a year ago, one doctor, it was about 1,600 patients for one doctor.
Okay.
And I mean, that's insane. You can't get quality care that way. And that's not the doctor's fault. They want to help,
Right.
and they want to do their jobs, and they want to help the veterans, and that's their
Right.
doctors,
Yeah. So when we talk about federal hiring freezes and saving the federal government money, that affects you. That affects all of
It
us.
affects
right?
everybody. But I mean, if you can spend billions on war, then you need to spend billions on taking care of people when they come home. I mean, that's just the way it is.
Yeah.
You can't. I guess they think they can have their cake and eat it too.
Yeah.
But I don't think veterans, they don't put up with a whole lot, and they're getting very riled up over a lot of this.
Are they?
Yeah. So a lot of them think we should go completely to choice and shut down the VA facilities. A lot of us think, I don't know which camp. I mean, I think we should have the option. I think the VA medical center should compete with
Okay.
the civilian care. But honestly, the reason that they're not competing with doctors is because they won't pay them. They won't pay what the civilian sector pays. But then we're paying millions of dollars to, administrators.
Right.
That's
So a
insane.
VA doctor doesn't make the same as somebody who, say, were to go work at Aurora or
From what I've
one of
heard,
the
no.
local-
That's why they've had a lot of, that's why you get the doctors and then they're gone. And another thing you get a lot of, which I'm not saying is bad, but as a veteran, you're already sick and you go to the big VA hospitals, and most of the time you really just see residents.
Okay.
You're not seeing,
You're not seeing specialists or anything.
sometimes you do. But if
Right.
you're in the hospital, like your group is residents, of course they're overseen, I mean, they have
Yeah.
a doctor over them, but
So if you were to have an emergency or something, you could go to
I go to St. Vincent.
you would go to you go to a civilian
I do.
hospital, and then that goes through the choice program, from what I'm understanding. And
If they mail it to the right hospital, yeah. But they've been messing it up and sending it to
Okay.
Iron Mountain. And the VA is not just the VA for everybody. It's separated regionally. Like, I get seen here in Wisconsin. I'm in the Wisconsin system. I live part-time in Crystal Falls, and I needed some medication that I needed to pick up, and that's only 30 minutes from Iron Mountain, right? I said, just transfer it to the Iron Mountain VA system.
right.
Well, we don't talk. They don't talk. So when my bill for St. Vincent's goes to Iron Mountain and it comes back saying it's not paid, because you didn't send it to the right place.
Right.
So it's hard.
Right.
I feel like I've not let you talk enough.
No, well, I mean, it kind of ties into, again, if we end up with the House bill of healthcare of their American Healthcare Association, or sorry, American Healthcare Act,
Yeah.
we end up with people who have pre-existing conditions.
Which a veteran is the definition of.
Right. What did you've told me you're a professional patient, right?
Yeah, the professional
Jenn is a
patient.
professional patient.
It sucks.
So we end up with people who can't get insurance, and many of them are veterans. We have people who are not veterans who can't get insurance. This really affects women. I mean,
it's really scary.
to me,
for
it
you
seems
guys.
like being a woman is a pre-existing
that's-
condition, like you said.
Yeah.
And then, so we have people like Jeremy who can't get the medicine that he needs just to live. And then we have people kicking back into your system, which is already overloaded.
Yeah, but they're saying that the answer to this is VA choice. But with the way that they're not paying these bills on time, there's a lot of providers that are not accepting that.
Right.
So.
Right.
But
Yeah.
at least when I look at it this way, I look at you and I hear what you had to do, and it makes me cry, because at least I had the VA. It might not have been the best care, and it might have taken a while. At least I had it.
Mm-hmm.
What does somebody do if they've lost Medicare? They're not a veteran.
Right.
What are we just going to let these people die?
Yeah. I mean, what are we left with, Jeremy? If we lose insurance, we're without it for 63 days, what happens? I don't.
Hopefully I can survive as long as I possibly can, and people like me can survive as long as they possibly can. It's a scary thing to think about. Our future is really not looking very bright right at this point.
Yeah, it's a really complex topic, and there's, again, no way that we can cover all of this in 30 minutes. I have a feeling this is going to be something that's going to cover quite a few episodes, because we really just touched on it, and it is going through the Senate. The Senate has to take up their own. Well, I believe they are saying that they're going to start fresh.
Well,
and
see,
do
that's the thing.
something
Nobody's
different.
saying that there's not, Obamacare is perfect.
Yeah.
I mean, I don't believe that from what I've seen. Telling my ex-husband I'd pay all that. But, I mean, things need to be fixed.
Yeah. I don't think anyone is saying it doesn't need to be fixed.
Okay.
Politics should not come into it,
Yeah.
which is what's happening.
Oh, well,
right now.
yeah. Well, we could do that there in my doctor's office every time I go in for a prescription, which you're going to bring us on for a talk about
Yes. Yep.
next time.
Yeah.
Well, not this next time, when you have
Yep.
time.
Jenn is definitely going to come back because she's going to come back and talk about her prescriptions.
Yes,
And that's a
I
whole
am.
other issue. So that should be really interesting. I can't wait for you to come back. And Jeremy will come back too, of course.
I have so much more to talk about on this
No,
topic.
I'm so sorry. I feel like we do.
No.
And I feel very sad when
You
I hear
deserve
your
a
story.
voice.
Well,
You deserve
do
a
too.
voice because honestly, I don't think your voice is heard.
But then thousands of dollars on credit cards for your I'm just, why do we charge that much for insulin?
I don't know. But this is
It's
real
not
life.
matter.
These,
Try not to cry.
yeah, these are people that this affects. It affects all three of us sitting
And
right
if you
here.
don't think it affects you, look at your mom. Look at your dad. Look
Yeah.
at your brother. Look at your sister. Look at your children. Like, people
Right.
say, how is this affecting me? I'm a veteran. My children are on my ex-husband's.
Yeah.
I mean, it affects everybody in some way, shape, or
There's
form.
somebody in your family that's affected.
Yeah.
Yeah. Everybody knows somebody. So I just think it's an important conversation that we have. And I hope that our representatives are watching this and realizing that
We'll
we're
blast
real
them.
people. Yeah. We'll blast them. We're real people. We just want a chance to live. And it's frustrating. It's really frustrating. It's frustrating watching them play politics with our lives, basically.
Yep.
Yeah.
Exactly.
Whether,
never killed anybody.
yeah.
Or the lack of having insurance, never killed anybody.
Well, and a whole other topic is that we can pick up our birth control at the grocery store, according to Glenn Grothman. So,
We could.
yeah, at a town hall meeting, he said, why do we need Planned Parenthood? Women can pick up their birth control at the grocery store.
Because they don't understand that Planned Parenthood is so much more.
3% of their procedures, that 3% of what goes on there is abortions. The rest is just women's care and also men's
It
care
is.
too for the poverty, the people below the poverty level.
Yeah, you'd be
Screenings, everything. Yeah. It's important.
whole other show.
Thank you for having
Whole
me.
other show. Can you believe it? We're done.
Oh,
This
jeez.
is,
I could go on forever. But
I know, we could go on forever. I think I really,
We'll have coffee.
what I would love to do is actually hook up with Political Radar Pulse and do a show just talking about people with pre-existing conditions. So
Totally.
I think that would be really awesome. Rhonda brought that up.
My
gonna put that
14-year-old has one now.
Wow,
Irregular
scary.
periods.
that's scary.
I mean, you're a woman, so here I am.
Right.
Existing condition.
Yeah.
Sorry, I know it's okay.
Yeah.
Fine.
So we have to wrap up, sadly.
That's sad.
Really.
They should really extend this to an hour.
Oh,
Agreed.
yeah.
Please.
So thank you guys so much for coming on. And I can't wait to have both of you back on. And I think this is going to be a topic that's going to be in the news for quite a while.
Yeah.
So, all right. Well, that ends Political Radar episode 3. Thank you again for coming on. For show notes, go to politicalradarecho.com/3. If you are watching this on YouTube, don't forget to like, subscribe, and hit that bell to get notifications. For great political content, please don't forget to check out Political Radar Pulse with Rhonda. And if you'd like to support the show, you can like it on Facebook, join the Political Radar Echo community group, and be nice while you're there. And you can buy shirts and other merchandise at politicalradar.com/shop. Thanks, guys.
Thank you.
Thank you.
Thanks for watching Political Radar Echo. To ensure that you'll never miss an episode, subscribe on YouTube or your favorite podcast app. To check out more episodes of Political Radar Echo, visit politicalradarecho.com or connect with us on Facebook or Twitter.